Good afternoon and good evening to everyone. I'd like to welcome you all to this exciting event on improving nutrition through accountability and data systems, smart nutrition for growth data commitments. It's great to see we have over 300 people registered with us today, and I'm sure that many of those will join and maybe more. So that's great news. My name is Sergio Cooper Teixeira, and I will be your moderator for today. I'm a strategy advisor at Nutrition International, supporting the Nutrition Technical Assistance Mechanism. I used to work at the Sun Movement Secretariat, where some may know me from, and also I was a REACH facilitator in West Africa for several years. Before that, I was a management consultant at BCG and Bain & Company. And I'm really glad to have been invited to moderate today's event because data has been central to lots of my own work experience, and I've seen firsthand the impact well analyzed and well presented data can have. So I'm really looking forward to today's presentations and today's panel. So today's event was organized by the Nutrition Data Partners Group. That's a group of development partners that has been meeting regularly for the last several years to better coordinate efforts in the nutrition data space. You will have seen their logos just on the previous slide. We'd also like to thank the Data for Nutrition community of practice, who are supporting logistics for this webinar. The DFN community provides members with opportunities to share knowledge, experience, and questions relevant to strengthening the nutrition data value chain at all levels for the purpose of achieving better nutrition outcomes in low and middle income countries. So thanks to them for supporting the logistics for this event. So before we start, I'd like to go over some logistics for today's event. So first of all, regarding language, please select now the language of interpretation that you would prefer. So translation is available in English, French, and Spanish. So to enable translation, select the interpretation button, and you can see it signaled there, and choose your preferred language. You may want to also select mute original audio. Give you all a second to do that. Next slide, please. Okay, so before we start, a couple of additional housekeeping tips. So everyone's video and microphones are automatically disabled, so you won't be able to enable those. So if you want to submit questions, please use the Q&A box. And to do that, click on the Q&A button. You can submit questions for the speakers, and then later on you can submit so you can submit questions for the speakers as the event goes on, and we'll have 10 minutes halfway through the event to pose some of those questions to our speakers. If you have any technical issue though, use the different chat box called chat, and send it to all panelists. Right after the event, a recording will be available on the Data for Nutrition YouTube channel. It'll take a couple of weeks before the presentations and a discussion recap is available and shared with everyone. Next slide, please. So I'd first like to welcome Dr. Kelly Stewart. Kelly will be telling us a little bit about why it's so important that we're here today to discuss this topic of data value chain for nutrition. Why is it so important and needed that we discuss this today? So Kelly Stewart currently serves as Chief of the Nutrition and Environmental Health Division with the Bureau of Global Health at USAID. Over a public health career that has spanned almost 30 years, Kelly has led efforts on a broad range of development and emergency response programs, including multi-sectoral nutrition, health system reform, maternal and child health, infectious disease, vector control, HIV, family planning, and reproductive health. She started her development career as a Peace Corps volunteer in Guatemala and then Honduras. She has a BA in sociology from the University of California, Santa Cruz, and an MHS from Johns Hopkins Bloomberg School of Public Health. Welcome, Kelly, and over to you.
Thank you very much, Sergio, for the warm welcome. And I would like to extend a warm welcome to all of our participants today. Welcome to this Nutrition for Growth side event, highlighting the importance of consistent and quality data on nutrition indicators. As a representative of USAID, where we greatly value and invest in nutrition data systems, I am honored to speak on behalf of the Nutrition Data Partners Group. As many of us know, the 2014 Global Nutrition Report called for a data revolution in nutrition, recognizing that data investments are needed to enable countries to design and implement effective policies and programs, mobilize resources, and monitor progress. While some progress has been made to improve nutrition data, current efforts are still insufficient, and I think we would all agree that our work here is definitely not done. The Nutrition for Growth Summit this year will be the next significant milestone for donors and countries to make global commitments towards achieving the World Health Assembly nutrition targets and Sustainable Development Goals for nutrition. With the global momentum behind the Nutrition for Growth Summit to improve nutrition for communities around the world, this is an absolutely critical moment for us to re-engage and double down on our commitments to improve data systems. Next slide, please. Data-driven accountability is a core focus of this year's N4G vision because improved data measurement and use is essential to make equitable progress on nutrition outcomes. As you can see here, few countries have made strategic investments in nutrition data and monitoring and evaluation activities. In data-dense 2019 review of national nutrition plans, only 33 of 58 countries had costed plans with sections on data and monitoring and evaluation. Of these countries, in several cases, a very small proportion of the budgets were allocated to data and monitoring and evaluation activities. Next slide, please. Well-functioning nutrition data and information systems guide the prioritization, collection, analysis, dissemination, and use of nutrition data in countries. On this slide, you can see that in the past 3 years, minimal funding is budgeted for nutrition data-related activities, including nutrition information systems, and funding appears to be plateauing despite the growing need. In the same time frame, donor disbursements fell short of a 5% benchmark for funding for nutrition data. Next slide, please. Given the importance of data to improve nutrition programs and outcomes, a call to action has been articulated in the Nutrition Data Partners Group Recommendations Guide. This call to action states that all countries and development partners should make specific commitments to strengthen the collection and use of nutrition data that reflect the following principles. First, allocate at least 5% of total nutrition funding to strengthening data and information systems. Second, attend to all elements of the data value chain, ranging from prioritizing what data to collect to fostering a culture of data use. Third, facilitate linkages between and access to nutrition and food systems data by all actors across sectors, ensuring a multi-sectoral approach. And finally, to ensure a robust internal system to track N4G commitments. Today, we will learn about examples and commitments along the data value chain to support further investment and commitments on stronger nutrition data. I hope today's examples can motivate new and further enhance existing commitments to include improvements to data monitoring systems. Strong data is pivotal to improving nutrition for women and children, particularly in the first 1,000-day period of growth between pregnancy and a child's second birthday. As we look towards nutrition for growth, we must elevate data across all of our commitments and take strides forward toward fulfilling the data revolution in nutrition. Thank you again very much for your participation in this critically important session.
Thanks so much, Kelly. And thanks so much for reminding us of why it's so important that all countries and organizations consider integrating or making a nutrition data commitment as part of the commitments that they're formulating for N4G. And it's pretty obvious that the need's high and many more data commitments are needed. So today's event aims to showcase and recommend potential actions that can be taken along the different elements of the nutrition data value chain, and to inspire you to turn those into commitments. We'll therefore see presentations that are organized along the different steps in the data value chain. So we'll first hear about data prioritization and data planning with speakers and an inspiring example from India. We'll then hear about data creation and collection, curation and analysis with speakers and examples from both Bangladesh and Malawi. And finally, we'll hear about data translation and dissemination for use in decision-making with speakers and examples from Niger. And that's how the agenda for the first portion of the event is structured. We'll have presentations along those three themes. And then we'll have a 10-minute Q&A session where I'll be able to pose a few of your questions to the speakers, and then we'll move on to a panel with a different set of speakers. So moving on now to next slide, please. So as I said, our first two speakers will be sharing India's experience with the first steps along the data value chain, data prioritization and data planning. Next slide, please. Let me introduce both of our speakers. So first of all, Dr. Purnima Menon is a senior research fellow with the International Food Policy Research Institute in New Delhi. Purnima is the theme leader for South Asian nutrition programs in IFRI's Poverty, Health and Nutrition Division, and directs the Poshan Initiative, partnerships and opportunities to strengthen and harmonize actions for nutrition in India, which supports the use of evidence for nutrition in India. She conducts implementation research on scaling up maternal and child interventions, including on evaluating large-scale behavior change communication programs in nutrition and health. Purnima has a PhD in international nutrition from Cornell and an MSc in nutrition from the University of Delhi. Our second speaker will be Dr. Divya Nair. She's a senior director at ID Insight, also in New Delhi. Divya's focus is on catalyzing evidence-informed decision-making to maximize social impact, having worked with national and state government institutions, multilaterals, and NGOs for over 15 years. At ID Insight, Divya leads teams to identify key challenges and design and execute a range of high-quality, demand-driven analytical services. Dr. Nair is deeply invested in addressing issues around health and nutrition and women and girls empowerment, and has also worked on financial inclusion, sanitation, and agriculture. So over to you, Purnima.
Divya will kick us off.
Hello, good afternoon, good evening, everybody. It's a pleasure to be here. I'm going to start and then hand over to Purnima, so we're tag teaming a little bit. Just to kind of kick us off, to kind of set the context. What we're going to be talking about is the work that we have been doing with the national government to support the monitoring of the National Nutrition Mission, and specifically our work with Niti Aayog. Niti Aayog is the government's official think tank, and they have been asked to monitor the National Nutrition Mission, which was kicked off in 2018. And ID Insight and IFPRI have been working closely with them at various points. So we'll be talking about some of the work that they've been doing. They've been doing a lot more. So this kind of just gives you a flavor of some of the key, pieces that we've been engaging on. So I'm going to pass on to Purnima, and over to you, Purnima.
Thank you. Could I have the next slide, please? So India launched the National Nutrition Mission, also called Poshan Abhiyan, in 2018, monitoring of the activities of the mission and the reach and impacts of the mission was mandated to sit with Niti Aayog, which is the national policy think tank. And so a lot of the work that is done around the monitoring for the National Nutrition Mission is anchored and led out of the national policy think tank. Quite a lot of thought went into thinking through the importance and the relevance of data in the context of the National Nutrition Mission. And given that, we believe that India is quite well positioned to be a strong example of leading nutrition data use across the data value chain. At the time that the mission was launched, several uses of data were anticipated and are in place. These include data to track progress, report on and assess the impacts of the mission. They include using data for strategy refinements at different levels and different time points, and using data for program refinements in an ongoing fashion. Again, at the time that this was set up in sort of late 2018, review mechanisms for the use of data and strengthening programs also existed and continue to exist at different levels, but guidance for how to approach the use of data was limited at the time of the launch. Next slide. One of the key steps in launching an effort to monitor the rollout of the National Nutrition Mission was actually outlining a nutrition data indicator framework. Both ID Insight and we collaborated with Niti Aayog to begin the work to lay this out. We organized a framework building on the sort of well-established conceptual frameworks for malnutrition, the UNICEF and Lancet and other frameworks, and also really the framework that and theory of change that the National Nutrition Mission itself was grounded in. So we organized that framework around interventions for which it was thought to be useful to track coverage, as well as determinants and impacts, and then use that to put together a framework of potential indicators based both on the program's theory of change and on existing interventions in the core national programs. These were also the platforms, these included the platforms that contribute to the delivery of the program. We then examined the data availability across available data sources in the country, both surveys and administrative data, to look at what was actually available to put around this indicator framework. And we've summarized our joint insights into an approach paper, which sort of outlines all the issues to consider in developing the monitoring strategy and the framework of indicators for India. Next slide, sorry. Now, the development of the framework itself was a long enterprise, and it really engaged a lot of people and created a lot of thinking about the theory of change and also where the interventions sat that related to the mission. But the other thing that the development of the framework did was identify several data gaps while also providing the community an organizing rubric, in a sense, to work with the data. So, for example, we found that there were 55 interventions across all of the multi-sectoral interventions in the mission, and only 6 interventions actually had available data across both survey and administrative data sources. 9 interventions had no data available from any source whatsoever. And we also identified several challenges related to the data, but nevertheless, the use of data continues. Next slide, please. One of the key users of data in the National Nutrition Mission in India has been the Poshan Abhiyan progress reports. These reports are led by Niti Aayog as a monitoring entity for the National Nutrition Mission. They are hosted in public domain, and the development of the progress reports in and of themselves is an enterprise in engaging people around data. To date, there have been 3 reports published. The first one in late in 2019 focused on early progress and on systems readiness. The second one, which was towards the middle of 2019, focused on not just on readiness, but also the unfolding of several innovations in the implementation systems. And then the last one before the pandemic hit focused on coverage and on using coverage data to predict forward. So, this has been a very nationally owned monitoring process, which has really built on the framework of indicators and other data sources. And hand back to Divya now. Back to you, Divya.
Great, thank you. Next slide, please. I'm going to quickly give you a few examples of some of the work that Niti Aayog has done, starting with primary surveys that they have conducted. In this case, ID Insight has worked with Niti Aayog and also with the Ministry of Women and Child Development. One of the key pillars of the National Nutrition Mission is social and behavior change communication. And so, given that a lot of messaging was going out across the country for a few years, across a number of platforms. So they were using 21 different platforms, from mass media to mid-media to, basically interpersonal communication. The question was, how are beneficiaries actually receiving it? So we conducted 3 rounds of surveys across the country that were representative of various, populations focused on women and children. basically provided information on, the reach, recall, knowledge, and practice related to key nutrition messages. Similarly, we've been working across some of the poorest districts in India, and each that meant we were collecting data with Niti Aayog for around 34,000 households, and providing information on a range of indicators, but particularly, the bulk of it was on health and nutrition. And so Niti Aayog was, getting a sense of the change over time, and across states regularly, and monitoring it and providing feedback to district officials in this case. We've also been working with administrative data, where we're trying to strengthen the quality of administrative data with third-party checks, but also just in terms of providing use cases of how can administrative data be used more, because a lot of data is collected, but it's often not used much. And related to that, we've been doing capacity building with the government and with IFPRI, where basically we've been working on, again, data use is how do you generate tables or graphs that are very intuitive and useful, and how do you analyze data that is available. And finally, we've been working on, as Purnima mentioned, setting up these frameworks that and reports that people at various levels can use. Last slide, please. So just in terms of reflections, we thought there are a few is ownership and leadership is for data use. It is important to also acknowledge that you might not have complete data, you might work with different varied qualities of data, but kind of really pushing on the data use piece is very important. And the sense is that the more you use the data, the quality of the data is also likely to improve. And finally, it's very important, as Purnima mentioned, there are plugging of gaps as we go forward. But I think in India there has been a lot of progress in terms of just the amount of data that is available. Certain but significant progress. I'll stop here. Thank you.
Thanks so much, Purnima and Divya. Thanks so much for your presentations, and basically for sharing with us some of the successes and challenges with developing this comprehensive framework of indicators for nutrition in India. So much there to learn, and it looks like lots achieved. Thanks for that. So in between presentations, we'll be sharing with you also some small updates or bits of information, and here's one of those. So UNICEF and the WHO team just launched the Fundamental series with 5 modules. It's an e-course, and it's to support countries in the design of implementation of national nutrition information systems. So it's just a little tidbit that we wanted to let you know about before we move on to our next presentation. So moving on then, I'd now like to introduce speakers from Bangladesh and Malawi, who will be speaking to us about the next 3 steps along the data value chain: data creation and collection, data curation, and data analysis. So we'll be hearing 2 different perspectives on a similar initiative that was undertaken both in Bangladesh and in Malawi. So I think our colleague from Malawi is going to speak first. So I'll introduce Mr. Isaac Dambula first. He's Deputy Director of Planning with the Ministry of Health. He's worked extensively in the field of population, development, and health management. Currently, he's the head of the Monitoring and Evaluation Division of the Ministry of Health, with the Department of Planning and Policy Development. And that's a role that encompasses a lot of data management for health service delivery. Our second speaker from Bangladesh will be Dr. Mustafis. Dr. Mustafis is Director of the National Nutrition Service with the Institute of Public Health and Nutrition at the Ministry of Health and Family Welfare. So Dr. Mustafis has over 25 years of experience in the field of nutrition planning, implementation, advocacy and social mobilization, management, training, monitoring and evaluation at national and international levels. He obtained his MBBS degree from Mymensingh Medical College in Bangladesh and a master's in public health from Atish Dipankar University of Science and Technology. So thank you both for talking about these steps in the data value chain. I think first we're going to hear from Mr. Isaac Dambula. So over to you, Mr. Dambula. Thank you.
Thank you, colleagues. Good afternoon. I will talk about introducing and integrating nutrition data in the DHIS2. That's the main data platform for Malawi. And this is for the purpose of development and the emergency context. Next. Thank you. Just as a brief background, we have made a lot of progress on the issues of nutrition in Malawi. For example, vitamin A deficiency has been reduced among 59 months, and the less stunting has been reduced for primary school going children, and also wasting has been reduced. But on the other side, we haven't managed to reduce overweight. That has increased. And currently, we have also managed to include the nutrition programs on this DHIS2 platform. That's the main data collection and management system. We are able to collect nutrition data and upload it on that platform. Next. Thank you. And as I said, we have a list on the left-hand side of the slide. You will see a list of programs that are now reporting to the data platform, programs related to nutrition that are now reporting. And also below that, you see a list of policies that we have that are guiding us in the management of nutrition data. And this is done at all levels. We have at facility level, where programs are reporting at facility level, and also at the district level, which is an aggregation of facilities within a catchment area, and also at national level, where we have all the programs related to nutrition data are reporting in the national data platform. Next. Thank you. Let me also mention about the lessons that we have learned. We have observed that clarity of laws on who is to report, who is to collect data, that is very important. It has the added value to our efforts, and also integrating various programs, reporting, collaborating, and reporting on the main platform. That has helped us, and also creating demand for data. That is also a good practice that we have observed. And also we need robust infrastructure in terms of nutrition data management. And on data use, we have managed to produce annual bulletins, quarterly bulletins that are being used by various programs and the partners, and also dashboards that one can use to guide in their program planning and implementation. Next. Actually, that was my last slide. Thank you so much.
Thank you, Mr. Dambula. If I can hand over to Dr. Mustafiz.
Yes, please. Oh, so next slide, please. So good morning or afternoon or evening to listener. I don't know who is part of the world. So basically, I want to Say, okay, it is my great pleasure and pride to present mainstreaming of the nutrition in Bangladesh and use of the district health information system as part of the integrated nutrition system to increase the coverage of the nutrition services. Prior to 2011, nutrition service in Bangladesh was just like ad hoc basis, fragmented, vertical. The government launched a minimum package of the nutrition in the name of the National Nutrition Services to be delivered throughout the government facilities under Ministry of the Health and Family Welfare in all the districts, all the hospitals, all the root level service center of the government. The initial implementation identified two bottlenecks: poor planning and management in the sub-district and sub-district level, inadequate skilled manpower. Next slide, please. To have whole sets of the core indicator nutrition, which did not exist before, and we have now all the indicators in our hand to achieve impact and outcome result. Relevant priorities output indicators were selected with a focus on tracking service delivery. As you can see in the output level, the orange row, we have 3 indicators from maternal nutrition: counseling, iron folic acid distribution, and the pregnant women weight monitoring. And 4th one is related to the child health and child nutrition, that is child weight monitoring, and infant and young child counseling, severe acute malnutrition, and vitamin A. Next slide, please. Okay. Once the indicators were agreed on, the paper-based register and the DHIS2 system were updated and ruled out. At present, nutrition service data are reported online monthly through district health information system from 13,500 community clinics, the lowest level health facilities, and the 480 sub-district hospital. This is operational in all 64 districts. Next slide, please. Okay. Now I would like to share 4 innovation that is related to the use of the data for decision making. Innovation 1, we have designed a multi-functional nutrition information visualized platform to facilitate timely and effective use of the data in an easy manner. This multi-level dashboard provides complete pictures from the national level, district level, sub-district level states on input, output, impact indicators. The main focus is output level indicator, which is updated every month. Now, with the support from the World Bank, $500 million pay for performance financing for resulting initiative is being implemented in 15 districts in 2 high burden divisions. We have 8 divisions in the country. Indicator disbursement linked with the services. So out of 16, nutrition got 2. So this is really working good because all the services is there and the indicators are uploaded through the electronic system, digital system. Innovation 3, apart from that, the individual tracker and the dashboard has also been linked with the Rapid Pro, a SMS gateway. SMS is sent to offer 3,000 health workers of community clinic that the lowest service provider with their score on a monthly basis. Innovation 4, recognizing data with the DSS2 in internal, also interpret external real-time monitoring and reporting of nutrition services using smartphone during the visit. It is low performing districts. The facilities based on the DHIS2 data are also targeted for mentoring. The data collected is automatically uploaded. Things are reported on real-time dashboard. The trigger reaction and action to address identified problem and bottlenecks. Next slide, please. with all this effort and the innovation, this nutrition data transfer also need to be realistic about the work it takes to get this level. We have started using data and see service like independent young child feeding counseling increase from 20% facilities to over 90% facilities. We are also identifying areas of falling behind the using of the priority nutrition reporting indicator data, PNRI, and support them. Finally, these efforts are applied in emergency as well as the humanitarian setting too. All of these prove that data system can be massively improved when there is a commitment and resource. Next slide, please. So these are some links. You can visit this link, which can help you to you know more details about our work. Thank you, everybody. This is short presentation from Bangladesh. Over.
Thank you so much to both of you, Dr. Mustafiz. Thank you so much, Mr. Dambula, for sharing with us kind of some of the different learnings, some of the differences, some of the similarities in how both countries have integrated nutrition data into district health information systems. And I think it's amazing and so powerful to see those visualizations of data and how the way that it helps, you know, a meeting take place, the way that it helps decisions to be made. Fantastic. So as we did before I move to the final set of presentations, we have a little bit more information to share with you. So if you take a minute to look at the slide, this time it's about a commitment, and it's a commitment to innovation in data collection from Peru. And next slide. And a second commitment, this time to integrating nutrition into district health information systems by UNICEF and partners. I'll let you read that for a second. Great. So let's move to our third and final set of country presentations. So in this case, now we're going to hear a little bit about from Niger around the final two steps of the data value chain. So specifically, data translation and dissemination for use in decision making. And we'll hear from two speakers on Niger's experience with NIPIN, in French, la Plateforme Nationale d'Information sur la Nutrition. Donc, c'est mon plaisir d'introduire les deux présentateurs qui vont parler un peu sur le Niger. Donc, d'abord, j'aimerais présenter Dr. Denisa Elena Yonet, ambassadrice de la France au Niger. Alors, Dr.
De l'Union européenne.
De l'Union européenne. De l'Union européenne. Correct, merci. De l'Union européenne au Niger. Donc, Dr. Yonet a étudié la médecine et s'est spécialisée en gynécologie en Roumanie, où elle a travaillé comme médecin et chercheuse à l'Institut de santé maternelle et infantile de Bucarest. De 2006 à 2011, elle a travaillé au secrétariat international de l'Organisation du traité d'Atlantique Nord, en NATO, on la connaît à Bruxelles, s'occupant de la coordination civilo-militaire, du renforcement de capacités et du soutien médical aux opérations. En octobre 2011, elle a été nommée chef de l'unité de gestion de crise et de la fragilité à la Direction générale de la coopération au développement de la Commission européenne. Et elle est depuis 2015 ambassadrice de l'Union européenne et exerce actuellement cette fonction auprès du gouvernement du Niger. Deuxièmement, j'aimerais aussi vous présenter Monsieur Sadou Bakoy. Alors, Monsieur Bakoy est actuellement le secrétaire général du ministère du Plan du Niger, ainsi que membre du conseil d'administration dans l'Institut national de la statistique du Niger, ainsi que président du comité national de pilotage de la plateforme NIPIN, la plateforme nationale d'information pour la nutrition. M. Bakoy a plus de 30 ans de carrière dans l'administration du Niger, où il a occupé et continue d'occuper des postes élevés. Il a été conseiller principal du Premier ministre et directeur général de l'économie au ministère de l'économie et des finances. M. Bakoy est titulaire d'un master en gestion, évaluation et de l'université d'Anvers en Belgique. Donc, merci beaucoup à Dr Yonette et M. Bakoy pour le partage d'expérience sur le Niger. Je pense que je passerai d'abord la parole à Dr Yonette, n'est-ce pas? Très bien, à vous, merci.
Merci beaucoup, merci pour tout. Merci de nous avoir invités. Moi-même, comme représentant des bailleurs et plus précisément du chef de file des bailleurs, du donor conveyor, pour délivrer juste une petite introduction avant que monsieur le secrétaire général présente la substance. Donc, qu'est-ce qui fait et pourquoi l'Union européenne est fortement investie dans ce projet? Premièrement, parce que nous sommes fondamentalement commis à l'engagement de 4 à 6% de l'ensemble des investissements, qu'ils soient consacrés aux données et aux systèmes d'information liés à la nutrition. Et nous avons en préparation maintenant la finalisation de la cartographie des bailleurs et on va regarder encore beaucoup plus d'attention cet aspect. Deuxièmement, parce que nous sommes depuis 15 ans un partenaire du gouvernement du Niger dans le domaine de la nutrition, tant sur des aspects structurels, comme c'est-à-dire la recherche des solutions à long terme pour la malnutrition aiguë et chronique, et aussi sur la gestion immédiate des crises alimentaires et nutritionnelles. Nous travaillons donc à tous les niveaux notre appui à nos partenaires nationaux, gouvernements, sociétés civiles, autres agences de mise en œuvre, passe donc par tout le spectre d'organisations et de structures mettant en œuvre ces interventions. L'Union européenne a pris des engagements en 2013 et nous souhaitons y être attachés. Mais il y a 3 éléments disons, d'avantage comparatif pour cette plateforme nationale d'information nutritionnelle. Premièrement, qu'elle permet de soutenir une approche multisectorielle à la nutrition, parce qu'elle assure la collecte, l'analyse se fonde avec une visée multisectorielle. Deuxièmement, puisqu'elle renforce en même temps les capacités des acteurs du secteur de la nutrition. Et 3, parce que, comme on dit, embedded, donc pris en compte dans cette approche, il y a aussi la création d'un environnement favorable pour la prise de décision d'un côté et aussi pour le plaidoyer pour l'amélioration de la situation nutritionnelle. Pour que ça réussisse, nos partenaires nationaux, comme ils vont vous dire, ont mis en place un montage institutionnel particulier, car pour mettre ça en exergue, c'est important d'avoir tant un leadership stratégique qui est avec le Haut Commissariat à l'initiative 3N, mais aussi une exécution placée aussi à un haut niveau à travers l'Institut national de la statistique. Vous allez apprendre plusieurs autres informations. Moi, je souhaiterais mentionner encore 2 éléments. Un, que pour nous, en tant que bailleurs, ceci représente aussi une partie d'un appui plus large au développement des statistiques et à cette philosophie d'utiliser l'outil statistique comme aide à la gestion, comme aide au plaidoyer et aide pour améliorer continuellement l'environnement, disons, de fonctionnement des institutions et de sensibilisation des populations. Il fait également partie d'une approche où nous soutenons globalement l'Institut national de statistique. Nous travaillons également sur les statistiques de l'éducation. On est d'accord comme l'éducation et la nutrition sont critiques pour le développement de l'enfance, dont le Early Childhood Approach est très important. Donc, on peut avoir encore une approche plus large, adressant encore mieux les causes profondes de la malnutrition et permettant un développement intégré de l'enfant. En tant que bailleur, je souhaiterais aussi mentionner, avant de clôturer, le fait que nous avons soutenu cette approche avec l'instrument et la modalité d'aide qui est la plus proche des besoins de nos partenaires, qui est l'appui budgétaire. D'un côté, en incentivisant la réalisation, donc l'adoption de la feuille de route de la nutrition et d'autres réformes avec l'appui budgétaire, mais également en utilisant cela comme un appui complémentaire. Donc, avec cette approche, nous mettons aussi à profit un instrument qui se veut celui qui est le plus avancé pour s'aligner sur les priorités, mais aussi sur les modalités opérationnelles de nos partenaires. Bien sûr, pour accompagner ces deux institutions. Nous avons aussi choisi des instruments très flexibles, comme par exemple la subvention et aussi le contrat de service, qui donne également une possibilité au fur et à mesure de s'adapter aux besoins. Troisième chose et finale, qui est peut-être la plus importante, est que fort de ces expériences, mais aussi de la pertinence de cette initiative qui a été mise en œuvre, comme vous allez l'entendre, par nos partenaires du Niger, et que nous confirmons notre engagement de continuer cet appui de 2022 à 2024 afin que toutes les conditions pour la soutenabilité, pour la pérennisation du processus puissent être réalisées. Et cela fera partie de notre approche dans le cadre de nouveaux financements multi-annuels 2021-2027, donc intégrés à tout un package d'interventions avec lequel on sera capable d'appuyer encore plus de synergie des programmes de développement. Bien sûr, il faut dire qu'ici, il n'y a pas que le Niger qui est appuyé, mais aussi d'autres 9 pays afin de continuer la mise en œuvre au Niger, tout comme dans ces pays, la mise en œuvre de la politique nationale de sécurité nutritionnelle. Et dans le contexte difficile géoclimatique du Sahel en général et du Niger en particulier, nous sommes sûrs qu'ensemble avec les partenaires, ces financements feront vraiment la différence pour la vie et la santé et le bien-être des enfants et des populations. Je vous remercie.
Merci, Excellence. Monsieur le modérateur, Mesdames et Messieurs les participants, Mesdames et Messieurs les panélistes, c'est avec un réel plaisir que je vais vous entretenir sur la plateforme nationale de nutrition comme un outil d'aide à la décision au Niger. Suivant. Suite. Il est important de noter la forte volonté politique et l'engagement du gouvernement du Niger dans la lutte contre la malnutrition. Ainsi, l'article 12 de la Constitution du Niger reconnaît le droit à une alimentation saine et suffisante. Entre 2011 et 2012, le Niger s'est engagé au plan international en adhérant au mouvement SUN et à l'initiative REACH. En 2017, le Niger a adopté la politique nationale de sécurité nutritionnelle et son premier plan d'action 2018. Cependant, il existe une insuffisance d'information dans la plupart des secteurs contributifs à l'amélioration de l'état nutritionnel des populations. Face à l'insuffisance des données, le gouvernement, appuyé par ses partenaires, organise des enquêtes régulières afin de disposer des informations utiles à l'orientation des politiques nutritionnelles. Il restait cependant un besoin important sur le suivi et la priorisation des interventions sectorielles et la compréhension de leurs impacts sur les objectifs fixés. La plateforme nationale d'information pour la nutrition PNIN, un système d'information intersecteur et une opportunité pour orienter l'action à travers l'analyse des données existantes, tout en renforçant les capacités nationales sur le plan institutionnel et organisationnel. L'expérience partagée avec vous aujourd'hui se concentre sur les résultats de la PNIN, bien qu'elle fonctionne en synergie avec d'autres outils. Suivant. Suivant. OK. Parmi les prérequis, il importe de mettre en place un système d'information centralisé. La PNIN du Niger est un portail comprenant différents outils de diffusion et de stockage de données et répondant aux besoins des informations des utilisateurs. Parmi les outils développés, je mentionnerai un outil de stockage et de diffusion des microdonnées, un outil de suivi des indicateurs multisectoriels sur la nutrition, regroupant 340 indicateurs provenant des secteurs contributifs et choisis à travers une approche novatrice de vérification de la qualité. des méthodologies adaptées au contexte national, permettant de mieux comprendre certains faits propres à nos contextes. Un système centralisé en lien avec le plan d'action multisectoriel sur la nutrition et des enquêtes spécifiques menées sur la nutrition. Une telle démarche doit permettre de disposer à long terme de plus d'informations de qualité pour l'orientation des politiques publiques. Suite. Pour être utile, les données doivent répondre à des besoins d'information et à la demande des utilisateurs et des décideurs. Au Niger, après une analyse des enjeux et défis de la nutrition, ces besoins ont été déclinés en plan cadre d'analyse biannuel avec l'implication des producteurs et des décideurs. Ce processus permet d'assurer une production en adéquation avec les besoins des utilisateurs de l'information sur la nutrition. Le renforcement des capacités des producteurs et utilisateurs fait également partie de l'environnement favorable à l'utilisation des données. La PNIN appuie et participe aux instances en charge de la coordination des interventions en matière de nutrition à travers le Comité national de la politique nationale de sécurité nutritionnelle et les autres instances de coordination sur la nutrition regroupant également les partenaires. Chaque analyse de la PNIN est validée par le Comité national, le Comité technique du plan national de nutrition et des ateliers d'interprétation sont organisés. Enfin, les analyses de la PNIN sont valorisées et leur dissémination est assurée auprès des décideurs afin de les sensibiliser sur le fardeau de la malnutrition et la nécessité d'allouer des ressources à la nutrition dans tous les secteurs contributifs. Suite. La production d'informations a une implication certaine sur la prise de décision. La cartographie des interventions et intervenants et les analyses de la PNIN ont permis de formuler des supports de plaidoyer en faveur de la nutrition au Niger. Le récent dépôt d'une loi sur le droit à l'alimentation au Niger par l'Assemblée nationale est l'un des résultats de ce plaidoyer. Sensibiliser les décideurs sur l'importance des investissements à travers l'analyse budgétaire présentée lors de la session budgétaire au Parlement. Élaborer la feuille de route du ministère en charge de la santé publique afin de permettre à l'État de planifier un engagement financier croissant dans la prise en charge de la malnutrition aiguë. Appuyer le processus d'élaboration de la politique nationale de sécurité nutritionnelle et son plan d'action multisectoriel et mieux prendre en compte la nutrition dans le plan de développement économique et social, principal cadre de référence pour toute politique de développement au Niger. Sensibiliser les décideurs à l'importance de mieux équilibrer les interventions de prise en charge et de prévention de la malnutrition. Renforcer la synergie des actions spécifiques et sensibles à la nutrition dans une approche multisectorielle auprès des décideurs et définir les 7 priorités dans la production des informations et des données lors de sa concertation nationale et la préparation de la note de synthèse des concertations pour le sommet des Nations Unies sur les systèmes alimentaires. Suite. La plateforme a montré ses résultats en tant que preuve de concept au Niger et élément contribuant à un environnement favorable à la prise de décision basée sur les données probantes. C'est une première étape et le Niger, avec l'appui des partenaires, compte poursuivre les efforts afin de garantir l'institutionnalisation et la pérennité de cette approche d'amélioration et de renforcement de la chaîne de valeur nutritionnelle et multisectorielle. Le Niger bénéficie déjà d'une deuxième phase de financement de la PNIN et a amorcé un travail de réflexion sur la pérennisation avec ses partenaires. Par ailleurs, le Niger a la volonté de décentraliser les processus afin de renforcer la mise à disposition des données et les capacités des décideurs régionaux qui sont au plus près de la mise en œuvre des actions et services en nutrition. Le Niger espère aussi pouvoir contribuer à capitaliser sur son expérience dans le cadre global de l'initiative des plateformes servant de modèle à d'autres pays sous et ou de la sous-région. Voilà, monsieur le modérateur, l'expérience de la PNIN du Niger que j'ai jugé utile de partager avec vous. Je vous remercie de votre aimable attention.
C'est moi qui vous remercie, monsieur Bakoy, et aussi Dr Yonette pour ce partage de l'expérience du PNIN au Niger. Merci beaucoup. So we now have one final small piece of information to share with you. Next slide, please. So an example here of, I believe not an actual commitment, but a potential commitment that can inspire you to think of the kind of commitment that can be formulated around data. Great. So if we can move on now, we have a few minutes to pose a few of your questions to our speakers. We've kind of done a bit of a prioritization of some of your questions based on how much time we have, but also, the questions that are harder that seem more specific to today's topic around data. So we've chosen 2 or 3 questions, but thank you everybody for the questions that you've posted, and where possible, if they're very specific questions but not specific to today's topic, we can also try and answer them directly in the Q&A window. So the first question is to either Purnima or Divya, up to you who answers the question. But some people are asking, so did your surveys provide information about who the users of nutrition data are and how they were using that data? If they did, what did you learn about those data users?
We did try to answer that in the chat. So we haven't done surveys of data users as explicitly, but our experience tells us that officials through the system, and not just officials, development partners and others, really do value data from different sources. I think the challenges are often that they're not, that the process of data use isn't necessarily as streamlined and uniform in the range of different review meetings that happen across the nutrition system. So for example, there are monthly review meetings within some, at a certain level. There are quarterly review meetings at other levels. And what we want, ideally, what one would want to see is fairly uniform data use guidelines across all of those, and then be able to track that. So that's all I have to say on that. Divya, I don't know if you'd like to add anything.
No, nothing further. I just wanted to just add that, the challenge is very much the format in which the data is presented and, discussed. And so really simplifying and choosing a few priority indicators and then having, a sense of what the actions are to be taken post the meeting based on the data. I think, really going into the nitty-gritty of all of this helps a lot to really get from data to decisions and actions. And, working on that is useful.
Thanks for that. And I think that ties to another comment that we saw in the chat box saying that, and I guess a follow-up question, different ways of trying to increase the number of data users and what you've tried. What have you tried to do to get more people to use the data? And the suggestion here is, of course, is that the more the data is socialized, so the more it's shared, the more users you'll have, but also agreeing with those users ahead of time on which key indicators would be reviewed. And then, of course, they would find those indicators and the data more useful. So I was wondering how much you've worked with users to actually shape what data they end up getting and how it's presented, and if that's helped.
Yeah, I think really, the ownership piece is very important in terms of making sure that the people who are using it have a sense that, they have complete, they have a lot of control in terms of choosing the indicators and also in terms of, how regular it is, where's the evidence coming from, and also eventually, working with government, there is the sense that they're able to choose what's going public, because that is also part of the, decision-making framework that they use. Is very often they want the data first to socialize it within their ecosystem.
Right. So there are sensitivities to manage as well, of course. Okay.
Yes.
Thanks, both of you. Now I'd like to send a question over to Mr. Dambula. Mr. Dambula, it's a question here about how in Malawi is the data and data analyzed with recommendations. How is it then fed back to district facilities? And is that done on a monthly basis? And how is it fed back? Mr.
Sorry, I didn't get the English. I got
Sure.
only
Okay.
French this side.
Okay, let me ask the question again. So, Mr. Dambula, so if you can tell us a little bit about the process by which data and I guess analysis and feedback is given back to districts and the regularity with which that's done. So how is the data and the analysis discussed with the districts and with what regularity is that done?
Thank you so much. At the lowest level, the facilities get feedback from the district because the facilities are have a collection of form a collection of a district. So the facilities get feedback from the district, and the district also is comprised into a zone. A number of districts form a zone. So the districts amongst themselves, they also provide feedback and reviews to each other and to the facilities. And we also have finally a national level review where all the districts get feedback from each other and from the national level. And the facilities get feedback on monthly basis, and the zones get feedback on a quarterly basis. And the national level feedback is once a year. Thank you.
Great, thanks so much, Mr. Dambula. Very clear and concrete answer. Thanks so much. I think we've got time for a third question before we head on to our panel discussion. This is a question for Dr. Mustafis. Dr. Mustafis, a very practical question here coming from someone about integrating nutrition data into DA at the district level. And somebody was, first of all, wanted to give you a compliment on that effort and that work, but asking a very practical question. How do you deal with poor network and I guess telephone and internet coverage in more remote areas? How have you dealt with that? Have you come up with alternative ways of working? Over to you, Dr. Mustafis.
Okay. Initially, it was really poor. Now the electricity supply is in whole country, and I do agree with you. Some hard to reach area are in Bangladesh. So in that case, they can upload the data online and offline. So they can manage this one. So they can upload and they can get, it will be automatically uploaded when they are online. So this is not a big factor nowadays. It was a big factor even 1 year back, 2 years back. So now it is okay. In electricity as well as the net connection is far better now. Sorry, I cannot listen.
Yes, thank you for that. So what I was saying was, so that means that a year or two ago, when internet coverage was still a problem, the solution was that the system could work offline, and then it would upload whenever they had internet available.
Yeah. That was the practice. Now it is far better.
Great. Okay, thank you so much for that clarification, for that detailed answer. Okay, so I'd like to say thank you to all of our presenters today from all our different countries and from the European Union. Thank you so much for your presentations and for kind of walking us through the different steps of the data value chain. So we'll now move on to our panel presentation. Next slide, please, for our panel discussion. Great. So for our panel, this is a panel where we will be posing the panelists certain questions. I'm afraid we don't have time probably to open up for lots of questions from the audience, but we will be posing our panelists a series of questions. And I'm excited to say that a lot of those questions are around commitments that those panelists are announcing or making. So that's great news. So first of all, let me introduce our speakers. So we'll be having panelists today from the Republic of Uganda, the Republic of Yemen, and the United States. From the Republic of Uganda, and I'll introduce everyone first, and then we know who everyone is on the panel, and then we can go into the panel discussion. So we're joined by two panelists from the Republic of Uganda. First, Ms. Samali Namukoso. She's Assistant Commissioner and Head of the Nutrition Division with the Ministry of Health of Uganda. Ms. Namakoso has over 15 years of experience working at Uganda's Ministry of Health. She provides coordination and leadership for health sector nutrition interventions, and that includes policy formulation, planning, implementation, capacity building, resource mobilization, advocacy, M&E, and research. Lots of different facets of nutrition planning and implementation. So Ms. Namakoso holds a BSc and an MSc in agriculture, a PGD in food and nutrition security, an advanced degree in business administration, and is currently working to complete her PhD in public health nutrition. So good luck with that, Ms. Namakoso. Secondly, from Uganda, I'd like to introduce Mr. Paul Umbacher. He's also an Assistant Commissioner with the Ministry of Health of Uganda, but as Head of Health Information. So Mr. Umbacher leads multiple initiatives in health information, digital health, knowledge management for the health sector, ensuring health information is used in decision-making and policy formulation. Seems so appropriate for today's topic. He's a statistician and a software developer with over 15 years experience in M&E systems, in research and data systems. He's previously worked with the Ugandan Ministry of Finance, Planning and Economic Development, WHO, and the World Food Programme. Welcome to both of you. From the Republic of Yemen, I'd like to welcome Ms. Karima Ahmed Al-Hada. So Ms. Karima is with the Ministry of Planning and International Cooperation and a Planning and Liaison Specialist with the Sun Secretariat in Yemen. And Ms. Al-Hada led the development process of Yemen's multi-sectoral nutrition action plan and nutrition strategy, and she led the development of Yemen's Sun Business Network. She's improving the multi-sectoral nutrition information system in Yemen and also working on strengthening national platforms by bringing as many diverse stakeholders together as possible. And recently, she was nominated as a member of Sun's Executive Committee. Welcome to Ms. Hada. And finally, from the United States of America, I'd like to welcome Dr. Erin Milner. Dr. Milner is Senior Nutrition Monitoring, Evaluation, and Learning Advisor with USAID in Washington, D.C. At USAID, Dr. Milner leads monitoring, evaluation, and learning efforts, and she manages multi-sectoral nutrition programs. She has 14 years of experience designing and implementing nutrition and health projects throughout sub-Saharan Africa. Previously, she directed several environmental health M&E programs and created resources for nutrition-sensitive agriculture programming. She led research in Kenya on nutrition linkages with ecosystems, food security, WASH, and early childhood development. Erin started out as a Peace Corps volunteer in Ghana. She holds a PhD in environmental health sciences with a focus on public health nutrition from my alma mater as well, the University of California, Berkeley. So I'd like to welcome all four of you to today's panel and say hello to everybody. And can we see everybody? Great. So thank you all for joining today's panel. And so I'll be first asking the delegation from Yemen for a few words, and then the USA, and then Uganda, just to let you know how we'll work this out. And I know that Ms. Halada is not going to turn on her camera today, but I know she was with us and she's listening, so that's great. So I think I'll pose the first question, and the first question is the same question we're going to ask everybody. So to Ms. Karima Al-Hada, in a few minutes, could you please share with us the 2021 N4G data commitment that Yemen has made to work on over the next 4 years, which means it has to be achieved by 2025. And also, could you tell us, why did Yemen choose this particular commitment? So over to you, Ms. Al-Hada.
Thank you so much. Good morning, good afternoon, good evening, everyone. Thank you for having me for today. Actually, we recognize the importance of timely and quality data with adequate level of disaggregation to guide the country decision-making and allocation of resources for nutrition. And hence, we appreciate the need to strengthen the nutrition information system and to enhance quality utilization of nutrition data, policy development, program design, and monitoring. Thus, our G commitment is that the government of Yemen commits to strengthen the national nutrition information system. This includes surveys, routine monitoring and surveillance, exploring opportunities for enhanced digitalization of data, evaluations, and strengthening human resources capacity. Yemen also commits to harmonize nutrition data and information system across sectors to reflect standards and core indicators that are aligned with the nutrition strategy, and to develop a national nutrition monitoring, evaluation, and accountability framework. So this is the commitment, and it was chosen actually to our accumulate effort in the country. As Yemen undertook a nutrition information system review last year, this process was very consultative in country, involving the Ministry of Health, UN agencies, NGOs, partners, and other donor communities. It was a successful experience considering the political divide in the country. This success proved the essentiality of supporting the systems and national and local technical initiatives in conflict-affected fragile context. It is a prerequisite for transition from humanitarian and short-term interventions to the developmental. So the review has resulted in a 3-year work plan that provide the roadmap for strengthening the NIS. The gap to be addressed in this work plan include development of a national nutrition monitoring and evaluation accountability framework, standardization of nutrition indicators, aligning nutrition indicators across other critical sectors, and streamlining of data collection mechanisms for program reporting and nutrition surveillance at community and health facility level. Also to rule out of district health information system 2, nutrition manual, dissemination of nutrition information, and finally strengthening human resources capacity to support the NIS in Yemen. So Yemen is among the front runner country for global action plan on child wasting. As such, the country, with support from the UN agencies, UNICEF, WHO, FAO, WFP, and UNCHR, has published a multi-sectorial plan geared at consolidating strategic actions to address child wasting in Yemen. In the coming months, Yemen will be finalizing the National Nutrition Strategy. The Nutrition Monitoring, Evaluation, Accountability Framework will be linked to this nutrition. Both these initiatives are key steps towards realization of this NIS commitment. Therefore, the N4G NIS commitment is built upon a thorough nutrition information system review and anchored on a 3-year NIS work plan, fully supported by the government and its stakeholders. On the other hand, actually, on the multi-sectorial information system, Yemen has been working on Map Yemen website to enhance the accessibility and availability of use of food and nutrition multi-sectorial data. Thank you.
Thank you so much, Ms. Al-Hadar, and congratulations to the Republic of Yemen for making this commitment and for it being such a well thought out commitment. Sounds like it's been 2 years or more in the making. Congratulations to you, and thank you for announcing that commitment today. I'll go straight to our colleague from the United States. So Ms. Erin Milner. Over to you, Ms. Milner. So probably a very similar question to you, really. Could you also please share with us the 2021 N4G commitment that you've made? And can you also tell us briefly why you chose this commitment and what kind of things you're putting in place to try and make sure that it happens? If you can do that in 3 to 4 minutes, three minutes max, please. Thank you.
Sure, thank you. So our 2021 commitment actually expands upon our 2017 data commitment from the last Nutrition for Growth Summit that we made with the Bill and Melinda Gates Foundation. We continue to partner with the Gates Foundation as another major donor prioritizing nutrition data. And the 2017 commitment was to engage in a partnership with the foundation to strengthen nutrition metrics that empower donors and practitioners to better track and evaluate our nutrition investments. This new 2021 commitment builds upon this and brings in new partners, specifically UNICEF and WHO, who, as we all know, provide global guidance and evidence on what data to collect and how to use it. And this new commitment and partnership aims to strategically enhance the quantity and quality of nutrition data. So we at USAID actually look forward to formally announcing the details of our data commitment at the upcoming Nutrition for Growth Summit. In terms of why we chose this commitment, we chose it because as a donor, we recognize the need to strengthen nutrition data, particularly in terms of availability and use, to ensure policies and programs are robust and designed and implemented to improve nutrition outcomes that are context specific. Therefore, as I mentioned, we are partnering with the Gates Foundation, UNICEF, and WHO to strategically increase the quantity and quality of nutrition data. Data are also important across all sectors, including health, food, and resilience. And therefore, we wanted to ensure that our global data efforts can inform our country partnerships and continue to address the complex multi-sectoral nature of nutrition. And this also aligns with our USAID multi-sectoral nutrition strategy, which highlights USAID's commitment to data-driven nutrition-specific and nutrition-sensitive programming. And then in terms of how we will make sure these commitments happen, USAID will ensure that these commitments happen by strategically continuing to work with our country counterparts to apply global evidence and metrics advancements. We also aim to expand work on nutrition data within health information systems and population-based surveys. And then finally, we are motivated to build capacity for increasing the quality and quantity of nutrition data collected and used in countries to develop policies and implement, monitor, and evaluate evidence-based nutrition programs. Thank you.
Thanks so much, Erin, for making the commitment and for announcing the commitment today. Great to hear. And I'm sure we'll hear more about it throughout N4G. So for our last presentation of a commitment today, I'd like to hand over to the team from Uganda. I do have to ask you to speak for 1 to 2 minutes each, maximum. So I have to ask you to be very brief, please. So I'm not sure if do I go first to Ms. Samali and then Mr. Umbacher, or the other way? Sorry, I can't hear you.
Ladies first.
Yeah,
okay,
ladies
ahead,
first,
please.
so I'll go first.
Thank you.
We are still living in the era of COVID, so you'll bear with us. We are two on the same table, so I have to leave my mask on. So we extend our appreciation to the organizers for this important webinar about the subject matter in terms of how we have invested in human resource capacity for nutrition programming and nutrition data reporting and why it is important. I want to say that all our data in Uganda, especially in the health sector, is integrated. And I want to mention that we have about 28 nutrition indicators that have been integrated in the health management information system and the district health information system. And in terms of human resources, I want to say that our health system is organized in such a way that we have the Ministry of Health at the central level. Then under it, we have the national referral hospitals, regional referral hospitals, we have general hospitals, we have health center 4s, 3s, 2s, and then the community. And then from general hospitals and above, we have biostatisticians and nutritionists. Nutritionists are primarily responsible for nutrition service delivery, while the biostatisticians are responsible for data management. So we work hand in hand in terms of data management. And specifically for nutritionists, they are really very, very instrumental when it comes to designing the data collection tools, interpretation of data elements, indicators, and knowledge translation. And I want to inform the meeting that currently we are going through HMIS review, and the team is actually looking at what data indicators are a priority, which ones are redundant, and this is the role of nutritionists. In terms of investing,
sorry, I don't mean to interrupt you, Ms. Samali, but because of time, would it be possible for us to hear from Uganda's commitment on N4G as well? I know that you wanted to present a bit of what's being done already, and also then present the commitment to N4G. Would it be possible for us to hear now the commitment regarding data, please?
Okay, thank you very much.
Thank you very much. Just to give a quick background, the data systems in Uganda are a bit of a hybrid, partly paper-based, and for the aggregate data, it is digitized. Our commitments will really focus on improving data use by improving its access. We plan to set up a national health observatory that, of course, will have a nutrition component, merging data from the service data from our districts, but also incorporating data on inputs into the health sector, like financing, HR, and others, also including data from the research, like operational research and other academia, to really present a single analytical framework for decision makers. We're also looking at digitizing at the patient level, because that is still paper-based. So really, these are the two main focus areas for us to really digitize capture at the point of care, as well as improve on that process of really putting the data from all these multiple sources into a single analytical framework to really ease that use by decision makers. Thank you.
Thank you so much. And also to Uganda, thank you for making that commitment and for announcing it today. It's very exciting to hear. Thank you so much, both of you, Ms. Namukose, Mr. Umbacher. So thank you to all our panelists for announcing their commitments today. Apologies that it was a bit under pressure of time, but we know how much work has gone into formulating your commitment, and we were all very excited to hear them today. So we're going to close today's event. I think while I'm introducing speakers, if we could just see, so just one final announcement here, a small, another example, this time from Nigeria, which might inspire also a commitment on data that you could make. So I'd like to introduce our two speakers that will close today, our event. So first of all, let me introduce Patricia Ngoran Tekli, who, as I said, I've known for quite a while. Patricia is advisor to the President's Office in Ivory Coast. She's the Sun focal point, and also she's the coordinator of multi-sectoral and multi-stakeholder platforms within the National Council for Nutrition, Food and Early Childhood Development. She's a government advisor for the Regional Excellency Center Against Hunger and Malnutrition. She's a physician. She specialized in nutrition policies, and she has 25 years experience in the field of health, of which 14 are in nutrition. She's also a member of the Sun Executive Committee for Francophone countries. She has been for the last month and a half. So over to you, Patricia. And I'm afraid I have to let you know that we have about 2 to 3 minutes.
Merci Sergio pour cette modération. Je suis ravie de pouvoir faire la synthèse de ces importants échanges. Nous saluons l'opportunité qui nous a été offerte à travers cet événement parallèle sur les engagements SMART pour les données en vue d'améliorer la nutrition à travers la redevabilité des systèmes de données. Nous voulons adresser nos vifs remerciements au gouvernement du Japon ainsi qu'aux organisateurs, à savoir le mouvement SUN, UNICEF, GHU, DataDent et la NIP. Toute notre gratitude va à l'endroit aussi des différents donateurs, l'USAID, l'Union européenne, la Fondation Bill et Melinda Gates. Nos vifs remerciements sont adressés aux représentants des pays, des différents pays qui ont participé. Il s'agit de l'Inde, le Bangladesh, Malawi, Niger, Ouganda, Yémen. Je m'en excuse si j'ai oublié certains noms. Nous saluons l'expertise mobilisée à travers l'ensemble des intervenants que nous remercions pour la clarté de leur présentation, la qualité de ces échanges, le partage d'expériences et de bonnes pratiques en matière de gestion des données, lesquelles méritent d'être disséminées. Tous engagés, il faut le dire, dans le renforcement de la nutrition, dans une approche multisectorielle en vue de l'élimination de la malnutrition sous toutes ses formes, avec des plans d'action multisectoriels budgétisés, des indicateurs définis, des cadres communs mis en place pour certains pays. Je dirais, nous restons convaincus que sans suivi et évaluation de ces indicateurs, de ces cadres communs des résultats, sans données surtout de qualité, il n'y a pas de prise de décision nourrie, ni de redevabilité. Nous naviguons donc à vue, ce qui est une grosse épine pour l'atteinte des cibles que nous sommes ensemble fixées pour l'Assemblée mondiale de la santé à l'horizon 2025 et celle de l'ODD 2 à l'horizon 2030. Cela est beaucoup plus parlant, voire délicat, quand il s'agit de faire un suivi comparatif au niveau régional, voire continental, et même mondial, avec des données se situant à différents niveaux d'actualisation qui ne reflètent pas la réalité du moment. Je pense que nous avons bénéficié à travers cette première présentation. Nous notons que des efforts soutenus, notamment dans le secteur de la santé à travers le DHIS2, pour renforcer les capacités le long de la chaîne des valeurs des données sont essentiels. Et la nécessité de renforcer cette chaîne dans les autres secteurs impliqués dans la nutrition et aussi la décentralisation du processus collecte, analyse, diffusion, utilisation en partant des communautés de base. Notamment, je fais un clin d'œil sur la situation d'urgence avec les alertes précoces. À cet effet, dans le cadre de la multisectorialité, nous notons les avancées obtenues avec la mise en place des systèmes d'information centralisés d'analyse multisectorielle, les PENIM. En plus du Niger, 9 pays bénéficient de l'appui de l'Union européenne pour cette initiative, dont la Côte d'Ivoire. Ces plateformes contribuent à un environnement favorable et à la prise de décision basée sur les données probantes. C'est le lieu de saluer toutes ces initiatives, tous ces efforts qui méritent d'être promus et soutenus pour un passage à échelle et une réplication à d'autres pays en s'inspirant et en construisant sur des systèmes multisectoriels de nutrition sur la base des secteurs qui représentent le plus d'avancement sur la question, comme a été le cas de la santé. Je profite pour vous informer, si je me permets.
Oui, je peux vous demander de terminer, si possible.
D'accord. Donc, il faudrait dire que les engagements qui seront pris à Tokyo par l'ensemble des pays, c'est l'idéal. Les différents points abordés soulignent l'importance pour les pays d'investir dans la nutrition. Et je voudrais y aller rapidement pour vous citer seulement un exemple sur l'importance des données. C'est comme un hôpital dans notre région pour symboliser l'importance de la vie. Le plus souvent, la maintenance et son financement ne sont pas prévus. Comment bâtir sur la durabilité? Prévoir le financement pour la gestion des données, c'est s'inscrire dans la durabilité de nos actions. Et nous saluons tous les pays qui se sont engagés dès maintenant, et surtout les donateurs, à faire du financement de la gestion des données une priorité. Je voudrais encore dire merci et nous encourageons les autres pays. Merci encore.
Merci beaucoup, Patricia, pour ces mots encourageants. Let me pass now to, we have closing remarks from Dr. Satoshi Izzo, Director in the Global Health Policy Division of the Ministry of Foreign Affairs of Japan. I do apologize, we're probably going 3 minutes over our scheduled time. So thank you for that. Thank you for your patience. Dr. Izzo has worked in Japan's public health and global health arena for decades. Most recently, he was the counsel of the permanent mission of Japan to United Nations. He was also involved in the WHO emergency reform as the first senior coordinator for global health. And finally, he's a medical doctor with a PhD, and he's completed 2 Masters of Public Health at Harvard University. Dr. Izzo's closing remarks will be in video, and after that, we'll be wrapping up the event. Thank you so much.
Distinguished colleagues, ladies and gentlemen, first, I would like to express my gratitude for UNICEF, SUN, Datadent, EU, Gates Foundation, and other members of the Nutrition Data Partners Group, and all of you who have gathered today to discuss on the initiatives to strengthen the monitoring mechanism on nutrition programs across the world. These experiences kindly shared today, especially in India, Bangladesh, and Niger, clearly demonstrate that good nutrition data is a fundamental basis in order for us to identify key populations who should be addressed, as well as to conduct more efficient nutrition-related interventions. We all know what gets measured gets done. With this in mind, I trust that you had valuable reflections and shared best practices on the steps taken to improve nutrition data. As we head towards the upcoming Tokyo Nutrition for Growth Summit 2021, it is critical that we commit to having good quality data to measure our progress in ending all forms of malnutrition. This is particularly important to make universal health coverage meaningful as well as a reality, and to build more equitable and sustainable food systems for all. Allow me to give you an example from Japan on the relevance of data in nutrition. Over years, Japan has worked to review how nutrition can be optimized and monitored across its population. The world's first nutrition research institute was established in Japan in 1914 and later became the National Institute of Nutrition. This institute contributed to the analysis of the ingredients of major foods, preparation of data, and establishment of standards of nutrient intake. In addition, through surveys and research by research institutes, Japan has accumulated scientific data that is the basis of nutrition policy and nutrition research for over 100 years. Japan has adopted the PDCA, Plan, Do, Check, Act cycle in order to promote health and nutrition policies efficiently and effectively in the country. Such experience is one of the reasons why we set data and accountability as a core theme of the Tokyo N4G Summit. Through the Tokyo N4G Summit and other efforts, we need to urge countries and organizations to invest in strengthening nutrition monitoring, which will ultimately impact the nutrition for populations today and for upcoming generations. I therefore look forward to welcoming you to Tokyo N4G Summit on December 7th and 8th with your ambitious commitments to fight all forms of malnutrition by taking advantage of today's rich discussion on data and accountability. I thank you.
And thank you so much for those words. And just to clarify that Dr. Satoshi Rose is Director of the Global Health Policy Division, the International Cooperation Bureau, the Ministry of Foreign Affairs, and that department is overseeing the N4G Summit and the N4G process that we're all working towards. So I'd just like to say thank you to all our speakers for having participated today. Thank you to all the commitment makers for having thought through those commitments, registered those commitments, and having announced them today. Fantastic. I'd also like to thank the organizers from the Nutrition Data Partners Group, as well as the Data for the Nutrition Community of Practice for having hosted the event. There were lots of people behind this event organizing it, and I want to thank them all personally. I think they made a fantastic job of this. So congratulations to them all. Just to let you know, the recording of the webinar is already available at the Data for Nutrition YouTube channel. But the copies of translations, of the presentations and the summary of the Q&A will be shared via that community of practice in the coming weeks. And you can visit the website there for more information. And for myself, I certainly feel I learned a lot today. So it's been a fantastic event for me to moderate. I've enjoyed it thoroughly. Thank you so much for everybody's presentations. And I hope everyone has a great rest of day or a great evening and a great run up to Nutrition for Growth on December 7th and 8th. Thanks so much, everyone. Thanks to the translators. Thanks to everybody, and have a good evening. Bye-bye.
Bye-bye.
Bye, everyone.